too late. So let's talk about oral hygiene, which is so very important, and ADA puts a lot of paramount importance on that. And it should start right when the mother is pregnant.
Yeah, so I'm happy to walk you through kind of our thought process, and it's, you have a mother who's pregnant and you want to make sure that before you're pregnant that you take care of active disease in your mouth, and things like root canal and extractions. We use anesthetics, you have x-rays, and you know, all these things going on, and you don't want to go through these things during the pregnancy. And right thereafter, you're so busy taking care of a newborn. So by the time you're realistically seeing a dentist, it's almost a year.
Wow.
And a lot of mothers don't realize, but active disease in the mouth can be passed on to a newborn and a toddler. So you want to clear those things. And you know, we tell the mothers at that time that when your baby is about 1.5 to 2 years old, you want to bring them in. And before that, even milk, you can't leave that in the mouth. You have to clean it out with a warm, damp cloth. And you know, a lot of mothers don't really know this. There's so many other things that take priority, but these things have a way of catching up to toddlers with early and severe forms of childhood caries.
Wow.
And you know, we want to make sure that when the kid comes in for the first dental visit, even prior to that, they've been receiving oral care in the house. And by the
So
time...
when should the kid come? You know, it should be like 1 year old?
1.5, I would say. That
Okay.
would be the perfect time. And just from a psychological perspective, for the mother-child bonding,
Right.
or for the child and dentist to bond, the earlier the child gets used to being around the dentist, even if it's just for a little bit of application of fluoride, it's so special, and it really helps smooth the transition of the kid, you know, into the dental and medical setting. And then by the time the kid is a few years old, the parents can start brushing the teeth at home, or watching videos, or, you know, reading books together about oral care. And it's an exciting visit. It's not very, you know, fearful and apprehensive type of setting.
Yeah. But I see this book, Sugar Bugs, and that's important for, you know,
Yeah,
mothers
so-
and mothers-to-be to look at this, because you talked about oral hygiene starting, like, you know, when the mother is pregnant, and then the kid should be there at a dentist's office when they're 1.5 years. Not
Yeah.
many mothers take their kids at that time.
No, they don't, and you're right about that. I would say Sugar Bugs I like because it's a little more descriptive, but I actually love it because I found it with this brand called Baby Buddy. And Baby Buddy actually has an entire program that walks the parents through different phases, like teething, which can be very nightmarish.
Hey YouTube fans, I'm Sneha. Thanks so much for checking out our YouTube channel. Subscribe to watch the latest interviews, ITV's coverage of feature events and digital exclusives. And don't forget that you can get ITV on Time Warner Cablevision and RCN.